Hello and welcome to Healthcare Environment Simulation, evaluating design options through virtual reality. My name is Tammy Thompson with Institute for Patient-Centered Design, and I will be facilitating this webinar with my colleague Andrea Hall. The Institute is a nonprofit organization established to develop and inspire creative design solutions that promote healing and wellness. We operate primarily through the services of volunteers who are practicing professionals in the fields of healthcare and design, as well as patients and parent volunteers. In 2013, we were proud to develop the Patient and Family-Centered NICU for the Healthcare Design Conference in Orlando, Florida. This project allowed our team of researchers, patient groups, and over 25 companies that you see here to detail a neonatal intensive care unit space in an evidence-based design process. This was a tremendous learning experience for us, so this year we're creating opportunities to share these lessons with the profession. The Healthcare Environment Simulation session is the second in a series that will familiarize you with the major project components that we considered. For those who are local to Atlanta or will be visiting the area, we invite you to visit our website to learn more about the tours of the actual model, which is on exhibit at NextSpan Healthcare. For all others, please join our mailing list for updates on future sessions. Now I'd like to ask Zach Gopal, our lead presenter for today's program, to introduce himself. Zach?
Thank you very much, Tammy. My name is Zach Gopal. I'm representing WorldViz and Architecture Interactive. We are a leader in virtual reality solutions. Been commercial for about 12 years. I've been with the company for about 5, doing business development and heading up the division that does design reviews and mock-ups and such. And very happy to be here with Tammy and presenting to you all today. Hoping that this provides some value, and thanks for everyone's time.
Before we get started, there are a few housekeeping items that I'd like to cover. This program is registered for one Health, Safety, and Welfare Continuing Education Learning Unit by the American Institute of Architects. Architects may submit their AIA numbers through the quiz registration following the course. All others may request a certificate of attendance through that same form. Unless otherwise noted, the following content presented is the property of the respective presenters. Please request permission before duplicating or distributing this material. The contact information for each party will be available on the course handout. Today, we will review options for presenting healthcare design solutions to end users by use of virtual reality simulation technologies. Zach will go into detail about the advantages of virtual reality technology on design projects, such as allowing owners and end users to validate a design prior to any construction and ultimately preventing change orders. We'll talk about the type of design simulations available to the industry now and how to gain access to them. Please use your question button to submit your questions. They will be addressed as time permits at the conclusion of the session. Now let's get started with a quick poll. What is your occupation? Andrea, would you please start the first poll? Great. We have 38% medical planners, 25% designers, architects, or interior designers, 13% hospital facility managers, no clinicians currently on the line, but 24% representing other occupations. Thank you.
Thank you very much, Tammy. All right, let's dive right into some of the learning objectives for today. So we'll discuss some typical healthcare design presentation methods. We're going to analyze different design needs or needs for design tools in healthcare. ID some different key tools to facilitate healthcare design, and then review a couple case studies where the technology has been used in the past. So typically when we're talking about design presentation tools, we're talking about tools to assist us in communicating the design intent. As many of you know, no matter what side of the poll you were just on, this can be a difficult and daunting task. It's easier for some of us to understand blueprints, renderings, fly-throughs than it is for others. And getting across the design intent is always a big challenge of a successful and efficient design process. Over time, we've used many tools to help us communicate the design intent, and the tools have evolved in their approach and in their value. So we began using simple sketches as forms of communication and design, and we moved on to more quantitative blueprints and on to small-scale physical models, and even, of course, to full-scale mock-ups. And more recently, tools like BIM and even scanning and drafting devices built into our iPhones and our iPad cameras exist to kind of aid in the evolution and the value of the design tools that exist today. So while the focus of this webinar is going to be evaluating the design process with the aid of virtual reality, there's many tools that I previously just discussed that are still very valuable and appropriate depending on the goal of the design presentation. Most often the tools you use to solve the goal at hand depends on what the design phase is that the project's in, the audience and the participants of the design review of your presentation, of course your budget for the presentation, and the timeline you have to prepare. So these typically will come into play and have a large factor in determining what tool is most appropriate to use. So we'll go through a couple of the tools and how I see them being valuable. So there's absolutely times where renderings are appropriate and helpful. They can be very effective. I bet at first glance, maybe some of you have a hard time looking or recognizing which was the photograph and which is the rendering on this slide here. So it does have a good ability to display some aesthetic and some spatial value to start to get the team thinking in a different way than a floor plan or a blueprint or a top-down view. But in other cases, they just happen to fall short. So here again, while this is more valuable than a drawing, than a blueprint, an end user cannot use such an image to evaluate lines of sight or to study reachability or to gain a true sense of scale. Designers and architects that are challenged with providing renderings to accurately depict a space, but the perspective and the field of view and many things come into play that can distort the actual design intent. And here, unfortunately, the value isn't much superior to the renderings, except essentially to see hundreds of different renderings. So you still have the issue of what was around that corner to the right and what's behind me now, and where are the design aspects of the space that are important to me as an end user or as a participant of the space. So here we solve many of the pitfalls of the rendering and fly-through kind of issue, and I'm just curious. Actually, we'll go ahead and shoot out one more poll right now. I'm curious what percentage of your projects use mock-ups currently? Would you say?
Okay. We're going
Physical
to
mock-ups, that is. Yep.
Okay. We'll give it a couple more seconds. We have about 75% of our audience voting. So, okay, good. Good. We reached 80. Okay, I'm going to close the poll and share the results. So Zach, what percentage of your projects use mock-ups? We have 25% saying, we have 15% of our audience saying 0% use mock-ups. We have 40% of our audience saying 25% of their projects use mock-ups. We have 30% of our audience saying that 50% of their projects use mock-ups. We have 10% of our audience saying 75% of their projects use mock-ups, and 5% of the audience today has told us that 100% of their projects use mock-ups.
Excellent. Well, that's great information. So I would argue that mock-ups are excellent forms of design communication, arguably the best form, especially when fit out with finishes and equipment and and all the works, if you will. They provide the real thing. I mean, what is there to mistake? These are critical to the design process that we're all familiar with, and I think they will continue to be a critical aspect, as you know, the physical sense of touch is key, and they provide a lot of value that even virtual reality definitely can't. But as we all know, they also have pitfalls, and they require a large amount of coordination and construction. They're built up to be torn down, and they cause a lot of waste because of that, of course. And what if you want to change the wall right there, or if you want to move the sharps container? You may have a hard time doing that. So one of the things that I'd like to educate us about today are you know, emerging tools that are available to the industry. These tools, emerging tools in virtual reality, can provide a similar and even certain cases superior value to a physical build-out. And one of them would be a 3D projection system, a multi-wall 3D projection system. Another would be a head-mounted display or an HMD device. And these tools can create virtual environments, which I'll explain can be very valuable for design, education, training, construction, etc. And for the final poll question, before we proceed, just curious how many of the audience members have actually used virtual reality on a project in the past?
Okay, great. Andrea?
I think we're waiting. There it is.
Great.
Last poll question, no more interruptions.
And we have great participation from our audience already. We have 80% voting, and we're exceeding that. I'll give it another second or two and close the poll. Awesome. 90%. Okay, and I'll share the results. So, Zach, have you used virtual reality on a project in the past? 26% of the audience says yes. 74% no.
Excellent.
So this is a great opportunity for people to learn.
Yeah, I'm curious also to learn the 26% what exactly their experience was and what kind of equipment and value they got out of it, what kind of equipment use and value they got out of it. So we'll just go into a little bit of detail here. Oops, sorry about that. So I would like to just get philosophical for a second. So what are virtual environments anyway? When you think about it, we create virtual environments every day. A great book can light up your imagination and put you in the feet of a character, put you on the edge of your seat in any moment. Perhaps even more intensely evoked, a virtual environment can be evoked with a really good movie or even a TV series or something. But nonetheless, somewhat easy to create and powerful. And by definition, we would define a virtual environment as an organization of sensory information that leads to perceptions of the synthetic or the artificial environment as being non-synthetic or real. So as perceiving the artificial to being real, again, kind of knowing, you know, you're not necessarily there and in it, but you can put your mind, you're kind of on the edge of your seat, and even though you know the story isn't real, you know, you will have the adrenaline and the actions, and you can dream yourself into this virtual environment and participate. And this exists on any basis of organized sensory modality. So you could even evoke a virtual environment from a crazy sound. You know, you can put yourself in a place that you wouldn't necessarily be with a big tree falling behind you, even though you're in a lab, for example. A major difference in an immersive virtual environment refers to an environment that creates a phenomenological state in which the individual perceives himself or herself as existing within the virtual environment. And this is the key value. And then this, we call this having a sense of presence, typically. Some of you may have seen or the movie or in the scene The Matrix, which they use the term the construct. And so I'll play this short video clip to introduce kind of the concept from a Hollywood point of view, if you will. Loading program. Hang on. I apologize. It's important to hear the beginning there. Okay, here we go.
This is the construct. It's program. We can load anything from clothing to equipment, weapons, training simulations, anything we need.
Right now, we're inside a computer program.
Is it really so hard to believe? Your clothes are different, the bloods in your arms and head are gone. Your hair has changed. Your appearance now is what we call residual self-image. It is the mental projection of your digital self. What is real? How do you define real? If you're talking about what you can feel, what you can smell, what you can taste and see, then real is simply electrical signals interpreted by your brain.
Okay, so we're not quite there, don't get me wrong, but the point of that video clip is to define that sense of presence and to put it in a different context, if you will, and the power and the value of that sense of presence. And I can assure you that, again, not to this extent, not to that intensity, but people using these types of technology actually do sometimes forget where they really truly are and sit down on a piece of virtual furniture and fall on the ground, or that sense of presence is valuable. And so what I'd like to just ask kind of the audience today is how effective and provocative are today's digital immersive virtual environments. And to give you an idea in a context specific to this technology, so I can assure you, like I said, they are very effective and provocative. So here's an experience where the person is in a head-mounted display and they're using motion tracking technology, so when they move 1 centimeter, it moves in 1 centimeter. And I can tell you, phenomenologically, they now believe that they are 10 meters in the air, and now as the floor drops down, they feel and believe as if they are 20 meters, 60-some feet in the air. And heart rate is racing, galvanic skin response is skyrocketing. All these things can be measured. EEGs are going nuts right now, and you'll see them look across the other side and take a big breath and run across to safety. And the key here, again, it's not in the context of design, which we'll get to in just a moment, but the key here is that the person perceives him or herself in this space. They're having an experience right now. This is quite the experience. We give them the opportunity. They're on flat ground to take a leap of faith, and they didn't move anywhere in the real life, but I can assure you that that is a very, very difficult task for them. And what's key here is that experience. They will recount this with physical presence as a memory in a different way than any rendering or fly-through can provide. So how does this translate directly into healthcare design presentation tools? These tools, again, they allow you to put yourself in the location that's of interest to you. So here's a nurse in an actual designer view who's able to put herself at her charting station and see her lines of sight, see what she's able to see, what she's able to reach. The call button is just a little bit too high for everyone in this patient room, and being able to move it this 12 inches is something you'd not necessarily ever catch on a floor plan designer view or anything. Does the IV pole fit here? So these all come from BIM assets, and with the BIM assets as your source for the VR environment, you have the flexibility to address in detail really any aspect of your design project. You can provide a virtual reality mock-up in many places where the design phase, the budget, or the timeline we discussed earlier might not allow a similarly valuable physical mock-up. Here's another effective tool that I mentioned in the beginning. This is the multi-walled 3D projection system. So again, the user is motion tracked, so the devices know exactly where this end user is, and the software engine re-renders the environment to that person's eyes 180 times a second. So this is virtual reality. This is a physical input from the user resulting in a one-to-one movement in the immersive virtual environment. Again, this provides a sincere sense of presence, and this value can only be matched really by a physical entity. And you can see, just some kind of basic quote-unquote features of this technology. He's going through a catalog right now, and he has a number of different medical props that he can add, but in this case, we got a little bit of, not criticism, but questions initially from physicians. The medical planners, the architects, the designers. One of their biggest questions early phase is, is the square footage large enough? Is your space big enough? And they said, well, yeah, but, with in a procedure, sometimes there's 7 of us in here. So what does that look like? What does that feel like? And so here's what he's doing there. He's starting to populate the operating room where he may have his actual help. And he's saw him before able to move the booms and, again, place himself as a physician perhaps in the area of interest to him. And the RN would do so for her in her areas of interest. And this really provides a communicative design tool that gets all mistakes and kinks and out of the design early phase. So what, again, just I want to reiterate, what is the value of this as a presentation tool? How and why is it so valuable? And in the end, it is that true sense of presence. And the sincere sense of presence, as I said, translates to design miscommunications being eliminated, to everyone's voice being heard too. This is another big one. To change orders being eliminated, of course, as a result of that, and these all happen due to the fact that you have the ability to manipulate and move things around, add objects, and something I'll touch on in a bit in one of the case studies, which is very key, is the ability to visualize different design alternates. So in many cases, the VR has the ability to kind of fill the gaps of the value where other design tools have fallen short. And again, so the kind of ideal result of all design tools, and this one in particular, is a cost savings, time savings. Often, ideally, communications are eliminated and therefore change orders never take place, allowing the project to finish ahead of completion or on time. And the waste reduction is a big one today. And in the end, the final two are really important to us all, to being able to provide excellent design services and high satisfaction to our clients, and ultimately to craft better places to live and work, to get rid of these pain points and to do so efficiently and effectively. So as I said to begin with, by communicating the design intent well, we can really get a lot of value out of tools like these, and we can use the tool not only as a design tool but also as an education tool and as a creative tool. We can push the limits of what's possible, namely with the design alternates, like I'll address here in our second case study. But first, on to a case study we did just a couple of years ago with one of the main sponsors of our show coming up, the Center for Health Design. So just briefly give you an overview. What was used was one of the high-definition head-mounted displays, kind of an experience similar to the ones you've seen, the 180 hertz motion tracking hardware, wireless interaction device, and then the real-time software that renders the BIM file. And the experience is, as we said, a sense of presence to scale, detail. And what was unique here was the ability for kind of a self-guided tour with different call-outs, displaying different evidence-based design features of this patient room mock-up. And so that was their goal, to illustrate at the VHA conference numerous evidence-based design features of hospital patient rooms using a physical mock-up or their initial here are some of the call-outs, that some of the design features they wanted to exhibit, and they had planned initially to build a full-scale mock-up to do so, which is a traditional and excellent way to do so. So on the right, I'm not going to read through them, but it's just kind of a list actually that the center gave us for a procedure with respect to the process and time and cost involved with organizing that physical mock-up. And instead, they decided to try the virtual reality mock-up, and in short, it was a very powerful experience for everyone. So the waste was a huge thing, the contracting, the elimination of any sort of safety hazards from all the building, and the self-guided experience was unique, and the virtual reality technology was actually very novel, and it actually provided value as a novelty, largely in addition to all of the messages it was displaying, but it was a novelty in that it attracted students of the teachings, and it was packed every single minute of this design conference, allowing people to go through and really learn these very important evidence-based features that institutes and people like the Center for Health Design spend their lives trying to to get out. So we were very happy to be a part of that one, and very similarly, we've been just privileged to be a part of Tammy and the Institute's different work in the last couple of years. So I'll let Tammy kind of stage the next case study, which was one that, as I said, we've done over the last couple of years with the Institute.
Okay, great. Thanks, Zach. We started about a year ago hosting an international design competition in search of a NICU design solution that would really enable families to remain in the neonatal intensive care unit with their babies for the entire length of stay. So that was our goal. These are our jury members, and many of them sort of stayed on to the project and helped us throughout the project in terms of the research that was involved in developing the final solution. Okay, and so this was indeed the final solution in rendering form and in the real. And I have to say that one of the things as a planner of this project that I wanted to point out is that each year when we set up our space, I talk to Zach about what kind of space he needs in order to do the virtual reality setup. And he always tells me that it's important to lay it out in the same size space, because essentially it allows the person to walk from one end of the room, the physical room, to the other end like they're doing in the virtual. So they walk from one wall in the virtual room to the other wall, and it helps us to understand the space. And so we thought it was extremely valuable for us, because as we went through the different design options and toggled through the design options, it was a great opportunity for us to see the space laid out on the floor. We were in an empty room, but just to see the amount of steps that it took, to get from one side to the next. And so for the onlookers, it was a great opportunity to measure all of those things, and of course we could see everything that the person with the headset was immersed in. We could see on the projection screen. So this represents our top 3 design projects, with the first place going to Stantec for Hospital for Sick Children in Toronto, the second place going to Hort Copeland Mott for MedStar Franklin Square Medical Center in Baltimore, and the third place going to Macmillan Paston Smith Architecture for Bon Secours St. Francis Health System in Greenville, South Carolina. So as I showed on the previous slide, we developed sort of a hybrid of the 3 for the NICU lab that we presented last year in Orlando. And I don't know if you wanted to talk a little bit through this, Zach.
Yep, thanks so much for introducing the Institute and our involvement. Yeah, it's been, like I said, a privilege to work with Tammy and her team. So one of the major kind of features of the tool that I'd like to outline for this case study is, as Tammy just touched on, were these design alternates and the power of these design alternates. So this is just a quick snapshot I took of, this is Tammy's floor plan from the architect, I believe, and the resulting virtual reality 3D mock-up model. And what we have the ability to do inherently in virtual reality is change geometry, change aesthetics, change everything and anything. So as this was what we called the main room, and this was the one that was actually built out on location as a physical mock-up, and it explained all of the kind of positive features, evidence-based design features of this NICU. And what we had the ability to do, and no one would necessarily want or be able to invest in for physically, was create numerous different alternative, less than ideal models with design features that are common in many design spaces like this that we see today. And this gave the Institute a powerful tool to not only show you kind of the right way to do it, but how it's wrong. And this is key. Again, this isn't just on a picture like you're seeing here, but the value of the participants of this workshop and workshop got to actually experience these negative design features and understand how they were less than good. So here's kind of from the interior, the difference between these two environments. And of course, this difference could be as large or as small as we wanted. But that's, again, one of the main kind of powers of this technology and of this tool. And so just wanted to show you a couple little pictures. Here's, we have what, maybe 20 sessions or so the last couple of years, somewhere around that, over the couple-day conference. And so we have typically an audience member of, about 10 to 20 people. And as Tammy said, so there's one kind of main user. She's down here in the bottom right. And we actually even put a chair there where there's a parent chair in the virtual environment, which I can tell you is really just takes it to the next level. Even when you turn around and do sit in a virtual object and it ends up being physical, it's quite powerful. But the rest of the participants, as Tammy mentioned, can see exactly, and it's not a valuable photograph up there right now, but can see what he or she is seeing as they're physically walking around through the model. And of course, we allow people to change it up and to each kind of gain their own experience. So after explaining and showing some different less than perfect, less than ideal design features, and also illustrating virtually, the main model, the group got the opportunity to go into the physical model. And I actually just made a little note here. I think what's kind of unique, actually, this session, Lashana is organizing it, is hosting it. She's one of Tammy's colleagues. She's great, and you can tell right now she's got everyone's attention, and they're actually going through a scenario. And so this is actually, potentially defined as a virtual environment that everyone's creating. They're creating a scenario in their mind and playing themselves through it, which is just an invaluable experience. And like I said, Lashana's just great at it. She has amazing experience. And these people were experiencing an immersive virtual environment. So they were having a sense of presence in this artificial space, in this made-up space, just as these people were imagining this made-up and fictitious kind of space that Lashana is explaining. But the combination of the two is just so powerful and valuable for the participants and really an enabler for learning, we feel. So here's just one last photograph from the outside of the mock-up. This is just the little section on the bottom of the floor plan to the right there, and then it went into the entire NICU. So like I said, we appreciated the opportunity to offer the tool, just as many others did, to make this experience a success. The physical mock-up in its full form and glory, as Tammy has been fortunate enough to have, thanks to all of her wonderful sponsors, is just invaluable. It's the most simple and effective tool, but after this short webinar, I hope all of you understand the value that's available to you today with the other key presentation tools in healthcare, like virtual reality. We all don't have the blessing that Tammy gets every couple of years to put one of these amazing pieces of work together on every design aspect that's in the book. And the technology and the tools that we've discussed today really have the ability to do that. So I hope, as I said, I hope this provided value to you out there, and I'm looking very forward to answering any questions that might have come up over the webinar, and thank you again for all of your time.
So Zach, I'd just like to say, as a user, could you scroll back a couple of slides?
Sure. Which one?
Show the lady with the headset.
Yeah.
So I just have to say, as a user and as an architect who has, met with many user groups and talked about design solutions, this is just a great way in the simulation lab to achieve our goal. Our goal in our patient experience simulation lab is to bring in the designers from the Healthcare Design Conference and talk to them about the family and the patient standpoint, their experience. And so in the NICU experience, of course, we didn't have a NICU patient, but we had the moms. We worked with a group called Hand to Hold. They're a nonprofit organization, and they are a support group for NICU families. They have about 20,000 members. And so during our research process, we were able to poll this group, and then we had some members there on site. So during the virtual reality walkthrough of the space, we were able to toggle through the different design solutions, and this was all navigated and narrated by a NICU mom or dad. And So our audience had a chance to sit there and listen as we looked at some of the negative features and the positive features and listen to their perspective as to why they felt uncomfortable or why they felt empowered in the various scenarios that we were able to quickly toggle through in the virtual reality. Okay, Zach, could you advance it toward Lashana? And so in this shot, it shows that after we went through that experience and sort of priming them for the physical model, we walked into the NICU room, and we always use practicing nurses. So Lashana is a practicing nurse in the mother-baby area, and she worked on the NICU for a number of years. And we had a couple of other NICU nurses there. And so they were able to literally put the participants in a wheelchair in the parent's chair and take them step by step through what actually happens in the space that we're doing for that particular year, and talk to us about why it's important. One of the main aha moments for a lot of people coming to the lab, which is sort of surprising for some of our clinicians, is that we had the mother's chair. You'll see the guy just next to Lashana, the nurse, sitting down in a chair next to the incubator. And in most of the design submissions that we received last year for this project, that chair was located on the other side of the room. And so it demonstrated to us a need to explain the relationship between that chair and the incubator, and that the parent sometimes can serve as the incubator for the baby, and that needs to be a close relationship. The baby has tubing, and there are cords and machines, and so it was a great way for us to actually show this and let the baby come out of the incubator and do some kangaroo care or skin-to-skin care with the participant. And so it was really a good way. The combination of this with the virtual reality setup was just an awesome opportunity for us to share all of this information and get people to really take sort of a walk in the patient's shoes. So that was sort of my take as a user of this experience, and we do it every year, and our participants are always very excited about this experience.
So as Tammy said, those of you who will be at the conference coming up, we will have an opportunity to show each of 3 different designs that were winning submissions this year as well. So any of you that are interested can come by and see the value firsthand of the experience.
Okay, now I think we can take some questions. So if you haven't already done so, please use your question button to submit your question now. And I'm going to see what we have already that we can read for you, Zach. Okay. First question is, what is the range of cost for converting a BIM model for a user into a virtual reality experience?
The range of cost, that's a good question. Of course, it depends on the range of work that needs to go into it, which oftentimes is a bit variable today since it's still a little bit emerging and new. Sometimes we receive a Revit file or SketchUp file or similar that is just really poorly authored, and it takes a little more time. But in short, we're typically spending between 1 and 4 days on the prep, the rendering, and then the kind of optimization and setup for the virtual reality experience. That translates to anywhere, $5K and up a bit. So 5 to 10K, probably a decent estimate for creating the experience, interaction, optimization, everything. For example, any sort of patient room or operating room or clean core, even the lobby, things like that.
Okay, next question. You mentioned that the Center for Health Design mockup would have cost $200,000. How much did the VR environment cost?
In the end, it was about 10% of the quoted $200,000 for the mockup. So again, we spent probably 4 or 5 days, maybe a week max, of art work, getting their BIM file translated over with the exact design features and callouts and interactions that they wished. And then we, of course, have a charge for the service that we provide to travel on site and bring the equipment and set up the technology and allow the design review or the mock-up or the users to be run through for a couple days. So between the two of those, it was approximately 10% of the 200K, so about 20,000.
Okay, so this is good information for planning purposes on a project. In the VR environment, when people wear glasses, can multiple people participate at once?
That's a great question as well. And the short answer is yes, absolutely. You add a little bit of complexity every person you add, and there's a couple different ways to do it. A couple questions: are they in the same exact physical location, or are they maybe in two separate tracking locations? Because you can get into tangling up and things. But no, there is a really big advantage to put, for example, a second person in. Beyond the second person, it can be a little bit messy, and honestly, as we discussed a bit, there's a lot of value from having a communication driven from the first-person viewpoint on the projector or TV screen as well. But absolutely, we can put multiple people in there. We represent them as an avatar of sorts, and so they can see each other, so they won't actually run into each other, and they can interact together. There's a couple videos online of this that you can see a couple clinicians going through a space. So absolutely, it provides additional value, but additional costs and prep as well, of course.
Okay, and I think you may have touched on the answer to this one. How long does it typically take from getting a BIM model to viewing into VR?
Yep, and of course, depending on schedule and depending on the model, how it's presented to us, anywhere from a half a day to about a week. It typically won't take us longer than a week, even if it's just a terribly messy file. The exception to that, of course, would be if for some reason you just have a very, very early stage BIM file with no materials or textures or anything like that, and you'd like a highly photorealistic model where we have to create textures and essentially provide design work similar that an architect or other service provider would do, then it can get outside of that kind of 1 to 4, 1 to 5 day window. But I'd say 90% of our projects lie in that range.
Okay. And I see a few more questions coming through on cost. I'm going to say that feel free to submit any question that you have. Just because this is a continuing education session, we're going to try to stay away from too much talk about pricing. But I will send these questions to Zach, and he'll be able to respond to you directly. Okay.
Thanks, Dan.
Let's go to another question. What environments and applications are you typically seeing today, and how do you expect this to change in the future?
Most of the design work or most of the mock-ups we're providing are within healthcare today. Most frequently there within an operating room or a trauma room, etc. Kind of these more complex design spaces where these lines of sight and these reachability, these things are not only a common issue but a very costly issue to correct. But definitely, we're seeing more and more areas. As I said, the cost is really in the BIM file. And you have that BIM file on hand, and so what this allows you to do is have flexibility to really address the small areas of a design, that wouldn't necessarily merit, the time and the cost and the money or the effort, to, build something out or even, have a dedicated design review. So there's, I think, a lot of potential to touch on all these little spaces with the technology, and that's key. So I see that kind of being the direction it goes in the future. And then outside of healthcare, we've definitely had interest in hospitality and some kind of real estate type of stuff, and also expect that to kind of pick up a bit as the technology becomes more familiar by the end user in the industry. So.
Okay. Another question we have is, are any changes that users make to the model recorded in case there are conflicting modifications requested?
That's a great question. So we do it within our software. We kind of purposefully don't push back any of these changes to the BIM source file, as that can kind of be a nightmare. But absolutely, you have the ability to quote unquote, provide like a sign off. As we said, one of the key values here is having end users give their first person feedback and their their sign off, and they're saying, I truly understand this environment and it is correct for me as long as I have my anesthesiology cart moved here and this boom placed 18 inches to the right in the ceiling. They make all of these changes, and then there is a save feature within the software that allows you to save that exact environment as it was manipulated with a name, for example, the physician's name or a date or whatever you'd like, and that can be used, of course, in the future as a no, Dr. John, this is exactly how we discussed and you signed off on the environment. Here's your manipulations. And as I said, most often these changes are not centimeters or inches. They're larger design changes, which are rather easy for the kind of the person who's managing the source file in Revit, for example, to translate over once they're agreed upon by everyone in the design process. But yeah, excellent question. It's key to be able to capture those comments and those changes one way or another, and that's the way we're currently doing it.
Okay, Zach, I have a question here that may require some explanation or for you to clarify something you said earlier.
Sure.
You indicate presentation to VA. Was it to a specific VA for a project or more to upper leadership to expose them to features and benefits? This would be helpful at a station level.
At a station level. I can answer the first part for sure. So it was actually at the VHA conference a couple years back. So it was an open, similar to the Healthcare Design Conference, but specific to the VHA. So there was a number of different kind of end users, professionals, owners, hospital, VHA hospital associates, and so on that had the opportunity to experience it. And I'm sorry, I don't quite understand the second part of the question.
If the author of this question wants to submit a part B or clarify, please feel free. In the meantime, I'm going to ask, Zach, did you have I think you had a fly-through that you might want to show us?
I left that to the end. Yeah, I mean, it's a final one we can go through. It was a different year. It was the year before that we worked with Tammy. This one here. So this is just the patient empowered room project we did. Again, there's some call-outs in here, and this is the view of one of the users there. So they have the ability, again, to look around and to physically walk through the space. And in this particular case, the choice was made to not author out the bathroom, so we didn't. But again, giving the user the ability to add objects and to really have an experience and a sense of presence in this space. And this was, again, the kind of our work with Tammy from 2012. I think.
So can I
Yep.
speak a little bit about that experience?
Mm-hmm.
It was awesome that we could actually put props into the space and move them around, because one of the things that we wanted people to know was how difficult it can be to grab onto an IV pole and navigate that route to the bathroom if the bathroom is on the other side across the room, or even placed on the head wall if the patient is getting out on the nurse side of the bed. Then placing the bathroom on the head wall doesn't really help if the patient is connected to equipment on the nurse's side of the bed. They have to get out on that side of the bed, maybe unplug some of the equipment, go with the IV pole, and walking around that bed. And we had an actual patient who had open heart surgery to go through that, walk us through that experience. So it was really valuable. I think a lot of people were able to get it, and just seeing that we were able to do the props. One of the other things that we did in that project was we moved outlets from one height to another height just to show, and the patient talked a little bit about the pain. It's, if the patient is in pain, what that might be like reaching down too low, and we were able to change those things. And so again, it was a good tool for us to just sort of teach from in terms of patient-centered design principles.
Awesome. Again, I really appreciate everyone's time here.
Okay, so Zach, we did hear from the author of the question.
Clarifying the question. Great.
Yeah, he said he thinks you answered the question.
Perfect.
So that it was at a national conference, not a specific project.
Gotcha. It was a national conference, yes.
Okay, good. So now we actually added a poll question, and Andrea, if you would please launch the poll. We just want to know, did you learn something new today? Okay, let's see.
Everybody knew everything, Tammy.
I'm just looking. I am actually going to share these results, which is, I thought would be kind of risky to ask this kind of question.
You guys can't hurt my feelings.
Okay, I'm going to close the poll. I better close it now. Oh, good, good, good. I'll wait a second or two. Oh, awesome. Okay, I am going to officially close the poll with 96% of the audience taking the poll and share what was said. 96, and this is ironic, 96% of you voted, and then 96% of the people who voted said yes, they learned something new. 4% said no, so that may have been one person.
All right.
Zach, is someone else in your office there? So maybe that's the person. So I have a few quick housekeeping items to go over before we're done. Okay, this is Zach's contact information as well as mine if you wanted to know anything else about what we've shared. Please remember to complete the survey, which will pop up immediately following this broadcast, in order to request a certificate of attendance or AIA continuing education credit. We will also send you a link to the handout to this presentation, as well as the contact information for our presenters. Please join our mailing list or check the NICU website, which will be on that email. It's patientcentereddesign.org/NICU. For more information about future webinars coming out of this project. Also, we wanted to let you know that we will be presenting the NICU lighting webinar again next week. For those of you who missed it in July, we will send out an announcement later on today with the link to register for this free session, and it will be a week from today, same time. So we look forward to seeing you on the next week's call. This concludes today's webinar. Thank you, Zach, for a wonderful presentation, and thank you all for joining us.